You've probably heard the term calcium channel blocker before. Well, today we're going to break down exactly what that means. We're talking about nifedipine, a medication that really changed the game for treating high blood pressure and chest pain. I mean, it sounds a little strange, doesn't it? How can one single pill do two seemingly different things? Lower the pressure in your entire body's plumbing and stop a very specific pain in your chest? Well, the answer is actually pretty brilliant, and it all comes down to controlling one tiny but super important element.
So let's start at the beginning. For decades now, nifedipine has been this go-to tool for doctors fighting two of the most common heart-related conditions out there.
So what is this stuff exactly? Nifedipine is part of a drug class called dihydropyridine calcium channel blockers. Yeah, I know, it's a mouthful, but the name itself gives us a huge clue about what it does. It blocks calcium channels. And as we're about to see, that one simple action is the key to treating both high blood pressure, also known as hypertension, and that chest pain we call angina. Okay, so how does blocking a teeny tiny channel have such a massive effect on your whole body? Well, it all starts with what calcium is doing inside your blood vessels in the first place. Just look at this process. Normally, your body sends calcium into the muscle cells that line your artery walls. Think of calcium as the go signal. It makes those muscles contract, squeezing and narrowing the arteries. Now, nifedipine steps in right here. It acts like a bouncer at a club door. It literally blocks the channels so most of that calcium can't get in. And the result? The muscle never gets the signal to squeeze, so it just relaxes. And the arteries open up nice and wide. And that widening effect? It has a name: vasodilation. Seriously, if you remember only one thing from today, make it this one. Vasodilation is what nifedipine is all about. When there's more space for blood to flow, there's less pressure on the artery walls. It's that simple, and it's an incredibly powerful way to lower blood pressure. But here's the really clever part. Nifedipine is a specialist. You see, some other drugs in this family slow down the heart muscle too, but nifedipine is what's known as a dihydropyridine, which basically means it strongly prefers the muscle cells in your blood vessels. It focuses all its relaxing power right where you need it most to lower pressure and pretty much leave the heart alone to do its thing. All right, so we've got our key action, vasodilation. Now let's connect that directly to the two main reasons it's used: hypertension and angina. For hypertension, it's pretty straightforward, right? Wider arteries mean lower pressure. Easy. For angina, it's a little more detailed. With chronic stable angina, by lowering pressure everywhere, the heart just doesn't have to pump as hard. A heart that's not working overtime needs less oxygen, and that prevents chest pain. Then you have vasospastic angina, which is where the heart's own arteries actually spasm and clamp shut. Nifedipine directly relaxes those spasms, getting the blood flowing again. Now, this next point is absolutely 100% crucial. The way nifedipine gets into your body has changed a lot over the years, and this evolution is a huge part of its safety story. So on the left, you've got the old school immediate release version. It worked fast, maybe too fast, causing a really sharp, sudden drop in blood pressure. On the right, that's the modern standard, extended release. This version is engineered to release the drug slowly, nice and steady over 24 hours. The difference in safety is just night and day. But what makes that rapid drop so risky? It's because of something called reflex tachycardia. See, if your blood pressure suddenly tanks, your body's emergency alarms go off. It tries to compensate by making your heart beat super, super fast. That sudden spike in heart rate can be dangerous, and it's the main reason that old immediate release formula is basically never recommended anymore. All right, time to talk side effects. The fascinating thing about nifedipine is that its side effects aren't just some random list of problems. They're actually a direct logical result of what the drug is supposed to be doing. Remember vasodilation? Turns out, when you widen blood vessels all over your body, you're going to get some predictable effects downstream. Just think it through. Widen the blood vessels in your head, you might get a headache. Widen them in your skin, you might feel flushed. If your overall blood pressure drops just a little too much, you might feel dizzy. And one of the most common ones is something called peripheral edema, which is just a fancy term for swelling. Now, this isn't the kind of swelling you get from a heart or kidney problem. It happens because nifedipine laxes the tiny arteries going into your capillaries a little more than it relaxes the tiny veins going out. This creates a bit of a traffic jam of pressure, especially down in your ankles and feet.
And that pressure can push a little bit of fluid out into the surrounding tissue. And voila, you get swelling.
And finally, let's go over the absolute must-know rules for taking nifedipine safely. This is the stuff a patient really needs to hear.
And the very first one might actually surprise you. It's a classic pharmacy warning, but for nifedipine, it is no joke. You have to avoid grapefruit juice. Here's why that's so important. Your liver uses a specific enzyme called CYP3A4 to break down and get rid of nifedipine. Well, grapefruit juice literally blocks that enzyme from doing its job. So if the enzyme is blocked, the drug can't get cleared out and the levels in your body can build up to a dangerous, even toxic level. Okay, this next rule, I can't say it enough. Never, ever, ever crush or chew the extended release tablets. The pill is designed with a very special coating to release that medicine slowly all day long. If you break it, you destroy that system and you end up dumping a full 24-hour dose into your body all at once. And that, as you can imagine, is extremely dangerous. So let's wrap up the rule book. Number 1, always swallow those tablets whole. Number 2, to avoid getting dizzy, get up slowly when you're going from sitting to standing. And finally, don't ever just stop taking the medication on your own. That can cause your blood pressure or angina to come roaring back. You always want to taper off with a doctor's help. And there you have it. From a tiny calcium channel to a powerful effect on your whole cardiovascular system. Nifedipine is just a perfect example of smart, elegant drug design. It really is a great reminder that sometimes the biggest changes come from the smallest, most targeted actions. So what medication should we dive into next? Let us know.